Our next speaker is a father to a 4-year-old and a 3-month-old, so he's clearly sleep deprived. He moved from Melbourne to Canberra for a wonderful opportunity at UC. We can discuss that. I did the same thing myself. If not a physiotherapist, he likes to think that he would have been a quantum physicist. From the Faculty of Health, please welcome Dr. Jamie Gaida.
I like to imagine a future where physiotherapists have a very difficult time finding work because of huge advances in the treatment of muscle, tendon and ligament injuries. In the 15 years that I've been a physiotherapist, I've treated thousands of patients, but the story of one patient in particular was particularly profound. Simon came to see me with a sore Achilles tendon, but his main complaint was that he couldn't kick the soccer ball with his young son, Finn. Every night when his dad came home from work, Finn would ask his dad whether his leg was better, and so whether he could come and play soccer. My research team have shown that metabolic conditions such as diabetes and high blood cholesterol not only significantly increase your risk of developing this injury, but they also prolong your recovery. The common factor among these metabolic conditions is an overactivity of the sympathetic nervous system. The sympathetic nervous system controls your heart rate, sweating, and blood flow to your muscles. My lab-based research has shown that people with Achilles tendon injury have a higher level of sympathetic nervous system, and that this correlates with the number of months and years that they've had this injury. I need to translate this research into improved treatment for patients. I need just $5,000 to conduct a clinical trial to conduct a clinical trial on these patients and demonstrate that this treatment delivers a benefit for these patients with Achilles tendon injury. So please help me translate this knowledge into improved outcomes for people like Simon so that he can get back to what really matters, kicking the ball with his son.
You're dodging the question.
I got a little bit nervous there, sorry about that. Ran off a bit too quick.
That's all right. Thank you, Jamie. That was a really good explanation of, I guess, some of the ills that happen and stop people being active. What application does this have in the sporting world? When things like AFL, soccer, but at a competitive level, and is that a place you might seek funding or partnerships?
Thank you for the question. I work very closely with the head of physiotherapy at the Australian Institute of Sport because chronic tendon injuries is one of their top 3 reasons why our athletes don't win gold medals. The other 2 are stress fractures of bones, overtraining syndrome, and the third is tendon injuries. What we do see is that there's a little bit of a difference in the risk factors between elite athletes and people in the general community. For elite athletes, the predominant risk factor is just too much load. They do too much training. But for the people in the general community who represent around 30% of the people with this injury, it's actually the combination of the metabolic factor plus the load. So for someone in the general community, it can be these metabolic factors plus walking to the bus or running to the bus. They combine together and then they lead to this injury. And the injury lasts for years and years. Anyone here who has it or knows someone in the family who has it? Richard has got this injury at the moment, and it's incredibly hard to treat. We have patients who have had this injury for more than 10 years. Is not uncommon at all.
Thank you.